A massive thank you as well, of course, to the Maternity and Midwifery Forum for having me speak today. As mentioned, I'm going to be talking all about avoiding treatment failure with oral iron. And I just want to say an extra special thank you as well to my wonderful sponsors, Active Iron. So a very brief run through about myself. My name's Louise. I am an experienced midwife. I am also the author of the Modern Midwife's Guide to Pregnancy, Birth and Beyond. I am a hypnobirthing and childbirth educator, and you may or may not know me from my Instagram account, The Modern Midwife, where I share a range of up-to-date evidence-based information and research, but also my very honest account of what motherhood looks like for me. Okay, so my talk today, as mentioned, is all about avoiding treatment failure. So the introduction and the topics that we are going to run through will be, of course, talking about iron and the fact that it is a vital micronutrient, deficiency itself, and the fact that that is a progressive journey. And also the current guidelines surrounding iron intake and HB levels. Of course, we're going to go on to talk about oral iron treatment and treatment failure and why that is so common, which I think some of you may be able to answer already, and avoiding treatment failure and changing the narrative. So something that I am very passionate about is changing narratives as per requirement. So, making sure that we are keeping up to date, making sure that we are also evolving our knowledge, expertise and care surrounding the ever-changing population. And then lastly, very excitingly, I'm going to also present some of Active Iron's brand new clinical data. So iron, as we know, it is a vital micronutrient and it is essential for oxygen transportation, for energy metabolism, cognitive function, blood cell formation and cell division, very, very important during pregnancy. It contributes to a healthy immune system, something that has been in the spotlight of late due to the COVID-19 pandemic. I think everyone's significantly more aware of their immune system and the functionality there. And also the fact that it affects everyone across the board. So it affects low, middle and high income countries, unlike other deficiencies. So the prevalence of deficiency, quite a startling statistic there on screen, which you may or may not be aware of, but 2.1 billion people are living with iron deficiency worldwide, which is huge, of course. Globally, it is the most common nutritional deficiency, and it affects, as mentioned before, low, middle and high income countries. And 1 in 4 women have low iron. And women of a childbearing age need up to twice more daily iron than men. And I think this is perhaps something that isn't spoken about enough. And, I'm very passionate about education and ensuring that we educate women as much as possible on various different ways that they can support themselves, their overall health and well-being. So I think that perhaps there are more conversations to be had around there, and even teenage girls surrounding periods and blood loss every month. It is important for us to have these discussions. So certain groups are more at risk, and just to name a few, those that are on restrictive diets, so vegetarianism, veganism, which is becoming more and more prevalent. A recent stat that I looked up illustrated that meat consumption has reduced by 17% on average daily over the past 10 years. So yeah, that's a reflection of just how much less meat we are actually consuming. And also other groups of people that are more at risk are those ladies that have had pregnancies very close together, ladies that are having twins, those that have had a history of anemia, just to name a few. And 67% of women experience heavy periods at some stage in their life. And of course, this can affect, this blood loss may well affect your iron stores. And 10 to 20% of menstruating women are already deficient preconception. So again, quite an important stat and very important for us to be aware of as clinicians as well. And once a pregnant woman is deficient, then diet alone won't be able to replenish those levels. levels. So this is about educating people pre-pregnancy and ensuring that they are getting enough iron, whether that be through their diet or supplementation, whatever that is, if they are planning a pregnancy. So iron deficiency and the progressive journey and the sliding scale. So as you can see there on screen, we go from having normal levels all the way down to iron deficiency anemia, but there is a window of opportunity there before you become anemic. And there's often the assumption that if your HB level is normal, then you're off you go, everything's fine, when that actually isn't the case, because you can have no iron reserves, but you can still have a normal HB, which brings me on to talk about ferritin levels and the importance of checking ferritin levels. So the current guidelines for iron intake during pregnancy, as I'm sure you're aware, there is a 2 to 3-fold increase in iron requirements during pregnancy and the postnatal period. And sometimes, you know, I think that we can forget, myself included, about that postnatal period and how important that is, because often women are still bleeding after birth, they'll often report being tired, and will perhaps sometimes put it down to that's a normal part of the postpartum period. And of course, sleep disruption is going to lead to tiredness. But it's always important to investigate a little bit further, because we are looking after women on an individualized care basis. So I'll go on to talk a little bit more about this in detail later on, but it's just definitely worth bearing in mind for that postnatal period that we are looking at it from a holistic perspective when women are reporting symptoms of anemia to us. Something I say all the time: healthy mum, healthier baby or infant. And we all know just how true that is. Of course, there are certain risks that we are unable to mitigate, but more often than not, looking after mum means that we're also looking after baby. So moving on to talk about the guidelines surrounding iron intake specifically. So the CDC recommend 27 milligrams of iron daily in America during pregnancy, and the World Health Organization recommend far more at 30 to 60 milligrams. And the definition of anemia. So anemia is often defined as a HB. And if we are going to talk about the specific trimesters and pregnancy, that would be 110 or less in that first trimester, 105 or less in the second and third, and less than 100 in the postnatal period. But as we've already identified, that HB levels aren't necessarily giving us the whole picture when it comes to anemia. The British Committee for Standards of Haematology and NICE recommend an FBC at booking, which we're all very familiar with, and then again at 28 weeks. But once again, there's that window there of opportunity, but also that window there where we aren't necessarily checking women's iron levels. And it's possible that those women that are more at risk at 12 weeks will have a normal HB. And by the time that they have that blood test at 28 weeks, actually within that time, they have become anemic. But if we are to check ferritin levels, then we are able to identify those ladies that are more at risk of becoming anemic, and therefore give ourselves and also the women in our care the opportunity to prevent that from happening. So the risks and effects on both mother and baby, and I'm sure that we are familiar with these, but just a very brief run through. So as we've discussed, the depletion of iron stores and ferritin levels, impaired hemoglobin production, and anemia in pregnancy. So that progressive journey. And then, of course, once you become anemic, you are of an increased risk of susceptibility and severity of infections. So not only are you more likely to catch an infection, when you do, the infection can be more severe. Poor cognition and low productivity. So lots of women say during pregnancy, they are feeling quite tired. And once again, it is important that we are considering anemia, and we are considering checking ferritin levels. Increased risk of maternal mortality and also morbidity, sadly. Increased risk of postpartum hemorrhage, and 3 symptoms I think that we're all really familiar with, because we see women coming into clinic quite often saying that they are fatigued, they've got shortness of breath and heart palpitations. Of course, we need to undertake all of our investigations surrounding those symptoms, but once again, bear in mind that ferritin level and whether or not they are becoming depleted. Depression, low mood and irritability. So something that is really interesting is the growing body of research to illustrate the effect that anemia can have on emotional well-being. So for babies, infants can have iron deficiency within the first 3 months of life. If mums have severe anemia, they are of an increased chance of being born at a low birth weight, being born prematurely, having congenital abnormalities, and also cognitive impairment or neurodevelopment, and increased risk of perinatal mortality and also morbidity. So traditional iron supplement let me just move that across there 1 second. Just making sure that you can see that presentation all okay. Okay, so traditional iron supplementation and treatment failure. So as I'm sure you are aware, there are various different factors that come into play when it comes to iron absorption. And there are different things that can affect that. For example, caffeine, dairy, calcium, all of these kinds of things can have an impact on iron absorption. And 8 out of 10 people report GI side effects. And I'm sure if somebody asked me to pluck that stat out of the air and say, or how many people do you reckon suffer with GI side effects? I would definitely say probably about 8 out of 10 of the ladies that I see after taking oral iron will report some sort of GI side effects. And then as a result of that, that can lead to 50% of lapsed users. So people unable to take their iron supplementation because the cure is effectively for them worse than their illness. Okay, so avoiding treatment failure and changing the narrative. So iron deficiency anemia, as we have discussed, has enormous health implications for both mum and baby. And the high dose of oral iron leads to an increased amount of side effects there. And oral iron failure may well lead to IV treatment, which I'm sure that many of us are familiar with here, with those ladies in the 3rd trimester if we're having to give things like Ferinject. And this is uncomfortable. Of course, being cannulated isn't the most pleasant of experiences, costly, and it's challenging for both mum and healthcare providers. So preventative supplementation is key from preconception to the 4th trimester for those ladies that are of an increased chance of becoming deficient. And prevention is better than cure. As we've discussed, those cures can be uncomfortable, costly, and difficult for everybody. So if we can prevent that from happening and intervene at an earlier stage by identifying these ladies, digging a little bit deeper, finding out about lifestyle, etc., and looking at things from a holistic perspective, we may well be able to preclude the need for those treatments later on. As midwives, we are the experts in normal pregnancy and birth. And by giving women this up-to-date evidence-based information and research, we are supporting them to take control of their health as well. And healthier mums and healthier babies, of course, leads to healthier pregnancies and births and better outcomes for everybody. And also I must mention as well, many women have low iron stores pre-pregnancy, and by the time that is identified, as mentioned, that problem can be harder to fix. So changing the narrative and the new clinical data by active iron. So the study designed, the screening study was with 204 women, and the purpose was to investigate the prevalence of inadequate iron levels in a screening cohort of women of a childbearing age with a self-reported history of intolerance to oral iron. So they were coming forward and saying, I have had difficulties taking iron, and they've had inadequate iron levels. And then the prospective treatment study shuffled down to 59 women. And the purpose here was to compare compliance, GI tolerability, efficacy associated with the 3 different doses of active iron in this self-proclaimed difficult to treat cohort. So the key findings, so almost 2 out of 3 in that screening cohort had inadequate iron levels. And the most common, I think that you'll probably be able to guess this, GI side effects reported were constipation, affecting 8 out of 10 women, and also abdominal pain and nausea, affecting 58% of women. And I think that during pregnancy, when you're already feeling nauseous, to add that on can be quite difficult. So the results with active iron. So active iron, for those that were in comparison to their previous oral iron, they had 4 times better compliance with active iron. And why would that be? Why would they be 4 times more compliant? Because of the tolerability. So there was significantly improved gut symptom score on active iron versus their previous oral iron. And as you can see there, that score didn't change over time, over the 12-week period. That remained fairly stable. And improving the tolerability of oral iron. So the tolerability of active iron, those people reported 6 times less gut irritation when compared to their previous oral iron. And really exciting finding here, the increase in iron stores over time. So active iron was able to replenish those iron stores over time. And there was a 94% increase. And again, that remained stable. So it took about 6 weeks for that to happen. And then it remained stable at that 12-week mark there. And the increased hemoglobin in patients with anemia as well. So their mean hemoglobin levels increased significantly across all dosages. And it's important to mention here that regardless if people were taking the 14, 25 or 50 milligrams, their symptoms, their GI scores remained the same as well over these different doses and over that 12-week period as well. And as you can see there, there was a gentle increase in the hemoglobin levels with active iron. And a dosage of 50 milligrams of active iron increased hemoglobin levels, and it also normalized those hemoglobin levels in 75% of patients with anemia. And, you know, a really important one, energy and fatigue. For obvious reasons, lots of people were reporting low energy and feeling quite fatigued during the pandemic, and this was undertaken during the pandemic. But as you can see there, despite all of that, those that were taking active iron had an increased level significantly over the study period. So all in all, to just give a recap of those results there, active iron being kind and strong, 4 times better absorbed, 4 times better compliance, on active iron versus previous oral iron, 6 times less gut irritation, 94% increase in the median iron stores, and increase in energy levels significantly over time. So Active Iron Pregnancy Plus is a complete nutritional solution for both mum and baby, and contains 21 nutritional ingredients, including really important things like methylfolate, omega-3s, DHAs, and of course, active iron. And you are more than welcome, and I'd really encourage you as well to please do oh, I think someone's screen's come up there maybe. Please do make the most of requesting your sample. You can activate it via your QR code there. And also there is a CPD module that is now available on the Active Iron Hub. And it's really great. It's full of brilliant information. And there's various different professionals on there that have written blogs and things that can be really, really helpful as well. So yeah, please do go ahead and grab your free sample there. Okay, so the conclusion, inadequate iron levels have, as we have discussed, have far-reaching health consequences for both mum and baby and the wider global community. Midwives have a key role in health optimization and education, providing holistic women-centered care and helping women to avoid treatment failure. Recommendation of routine supplementation from preconception to the postnatal period in women that are at risk of developing those inadequate iron levels. The new clinical data on active iron that shows that it's both kind and strong and is also proven to increase iron levels whilst also avoiding those negative GI side effects. Pregnancy Plus being a game-changing supplement that offers the complete nutritional solution for both mum and baby. And as I've said, please do take advantage. We all love a freebie. So please do take advantage and get your free full sample size on the website there. So thanks so much. I feel like I spoke very quickly there, but I know that we have a short amount of time. So thanks so much for listening to me. And I believe we will be doing questions at the end.